Hello, my name is Sade Lopez. I am a nursing student, and I will be performing my GI's nursing skills, which will be insertion and removal of a NG tube. I've already checked the MARS for a physician's order. I've identified my patient. I identified myself. I explained the procedure to the patient and why the patient will be receiving an NG tube. I have all my equipment ready. I have my 16 French NG tube, a 60 cc syringe. I have a towel. I have a basin just in case the patient needs it. And I have the lubricant and my tape that I'll be using as well. Okay. The patient's already in a high Fowler's position. The bed is raised at my level. Side rail is down for easy access. I've already performed my hand hygiene. I have provided privacy, have my gloves, and now I'm ready to begin the procedure. Before I start the procedure, I'm going to have to assess the patient's nares and oral cavity for any obstructions. At this point, I'm going to ask the patient if he or she has had any previous surgeries or a nasal septum. And hypothetically, at this point, the patient doesn't have anything wrong. I've already lubricated my tube and I'm ready for insertion. Before, I have to measure the tube from the nose to the ear, and then from the ear to the xiphoid process. I'm going to put a piece of tape just so I know how far I can go in. All right? Go in slowly. And as I'm going in, as soon as I feel that resistance, the patient's head is tilted back. As soon as I feel that resistance, I'm going to instruct the patient to bring his or her chin to her chest, and also instruct the patient to drink some water for swallowing. And every time the person swallows, I'm going to keep inserting the tube until I've reached my landmark of the piece of tape. All right? And at this point, I'm going to have to, if the patient starts to gag or choke, I would immediately ask the patient his or her name. If the patient is unable to answer the question, I would remove the tube immediately. If not, if the patient was able to answer the question, then I can just continue with the procedure. And the next thing for me to do to make sure that the tube is in the right place, so I can do one of two things. I can get 30 cc's of air and insert it into the tube and auscultate for a gargling noise, which is present. Another way I can do it would be to aspirate some gastric contents, very little, and then just use a pH strip to make sure that it's in the stomach. So at this point, the patient's tube is in the stomach. I can then take off the piece of tape that I have here. Use another piece of tape to secure the tube to the patient's nose. I would also secure this tube to the patient's gown. If the tube is not in the right place, I can either insert the tube 1 to 2 inches, and at that point, if it's still not there, then I would have to take it out immediately. Okay, so then I would, and at this point the procedure is over. I would put the patient back into a 30-degree angle, bring up the side rail, give the patient the call light, document what the procedure, the type, the nair, which side of the nair that I use, the type, my equipment, and any abnormalities that could have happened. I would perform hand hygiene, and that's it. Okay, now we're removing. For this part, again, I would check the physician's order. I would identify the patient, identify myself, let the patient know that I'm going to be removing his NG tube, and also let the patient know that the removal is not as stressful as the insertion. So before I can remove any tube, I will have to auscultate each quadrant 5 minutes, and I'm listening for bowel movements. If there is no bowel movements present, then I will not be able to take out this tube. In this case, I heard bowel movements, so now I can remove. Right. So I'm gonna start by. Oh, that's right. I'm gonna have to turn off the suction before I can remove the tube, obviously. So I would remove the tape first. I have all my equipment. I have provide the patient with a piece of tissue for after. I have the basin, I have my towel, and I have the chucks for protection. Now at this point, I would instruct the patient to take a deep breath and hold. And as the patient holding the breath, I would take out the tube, wrap it around the chucks, clean the patient's nose. All right, and the removal of the NG tube is over. At this point, I would bring the bed at the lowest possible for safety reasons, make the patient comfortable, provide the patient with a call light, document what I did. I would raise the side rail and perform hand hygiene. And that's it. Thank you.